Good morning, good afternoon, and good evening, esteemed professors, doctors, guests, colleagues, and participants from all over the world. Welcome to Health Challenges of Refugee Children, an international webinar conducted by the International Pediatric Association. Uniting thousands of registrants from all over the world, the Health Challenges of Refugee Children International Webinar discusses the experiences and lessons on addressing the health and well-being of refugee children from various countries to hopefully shed light on how we can better support children and families during humanitarian emergencies. Before beginning today's webinar, we would like to inform you of the rundown of this webinar. We will begin with a welcoming address from the President of the International Pediatric Association. Then we will have the presentations from our distinguished panel of experts moderated by our esteemed moderators. There will then be a question and answer session with our speakers. For the smooth running of today's event, kindly pay attention to the following rules and regulations. Participants are encouraged to have their videos turned on throughout the webinar. Participants should keep their microphones off unless permitted by the moderators. And to obtain the certificate of attendance, participants are required to attend the entire duration of the webinar and fill in a feedback form, which will be distributed at the end of the event. To officially open the Health Challenges of Refugee Children webinar, we will now respectfully invite our first speaker to deliver the opening remarks. Professor Enver Hasanoglu, MD, FAAP, is the President of the International Pediatric Association, Secretary General of the Turkish National Pediatric Society, and Secretary General of the Union of Middle Eastern and Mediterranean Pediatric Societies. He has also held the rectorship position in Gazi University, Ankara, Turkey, between the years 1992 and 2000, where he was also the Dean of the Medical School for 9 years and a member of the Turkish Higher Education Council for 4 years. For the past 20 years, he has been involved in many programs in Turkey and in the Middle East region, especially on immigrant child health matters. He has been awarded many honorary fellowship titles by various societies across the world for his tireless work and contributions to child health. Without further ado, to the professor who needs no introduction, to Professor Hasanoglu, the time and screen is yours.
Thank you, Helena. Dear colleagues and participants, I am Professor Enver Hasanoglu, President of IPA, President of International Pediatric Association. I would like to welcome all of you to this webinar organized by IPA entitled Health Challenge of Refugee Children. Unfortunately, by the end of 2020, the number of people forcibly displaced due to conflict, violence, and human rights violations had grown to more than 82 million, which was 41 million in 2010. It means it doubled within 10 years. Dear colleagues, more than 2/3 of all refugees come from Syria, Venezuela, Afghanistan, South Sudan, and Myanmar. My country, Turkey, is hosting the highest number of those refugees. In 2020, 36 million children were international refugees. I am sure after this conflict and war in Ukraine, this number will increase. These children, without any doubt, has the same rights with the children who are not refugees. However, their needs and the risks are much complicated. They face several challenges. They face challenges at camps in the host community. They die or get injured. They encounter many communicable diseases, food insecurity, and malnutrition. their development and education is affected negatively. Adolescent health being another challenge. Some of these children became soldiers or involved in child labor, and child marriage increased within these refugees also. And last but not least, the mental health burden may have lifelong effects. Unfortunately, nowadays, COVID-19 and excess climate change just add on this large toll. The worst is that all can be preventable. I believe this webinar will contribute to advocating for and working in collaboration for refugee children everywhere. I would like to thank the esteemed speakers and moderators, and of course, SAG on Children in Humanitarian Emergencies for organizing this activity. And of course, I would like to thank all of you for your attendance to this webinar meeting. Thank you and best wishes.
Thank you, Professor Hasanoglu, for your opening remarks. We will now proceed to the next agenda of the webinar. The next agenda of our webinar will be moderated by two very special and distinguished moderators. It is my great honor today to introduce our moderators for the session. Professor Aman Bakti Pulungan, MD, PhD, FAAP, FRCPI Honors, is the Executive Director of the International Pediatric Association, past President of the Asia-Pacific Pediatric Association and City Child Governing Council, and past President of the Indonesian Pediatric Society and the Asia-Pacific Pediatric Endocrine Society. He is also a professor in pediatrics at the Department of Child Health, Faculty of Medicine, University of Indonesia, Cipto Mangunkusumo Hospital. For the past 20 years, he has been involved in many programs for diabetes and child health in Indonesia and across the globe. He has been awarded by the Indonesian Ministry of Health as one of the most eminent person who has been actively involved in a national immunization program, as an honorary fellowship by the Turkish National Pediatric Society for dedication and contribution to child health, and as an honorary fellow of the Royal College of Physicians of Ireland. Recently, Professor Aman has also received the Republica.co.id Inspirational Figure Award 2021 for his work in children's health during the COVID-19 pandemic. Good evening, Professor Aman.
Hello, good morning, good afternoon, good evening.
Thank you, Professor. Now I'll be introducing the next moderator of the session. Dr. Ozlem Teksam, MD, PhD, is a professor of pediatrics in Hacettepe University, Faculty of Medicine, Department of Pediatrics. She's the director of the Division of Pediatric Emergency Medicine since 2009 and the director of the General Pediatric Outpatient Clinic since 2004 at Hacettepe University. She has more than 100 international and national publications, including book chapters. Her specific areas of research and study are triage in hospital, injury prevention, trauma, and toxicology. She's a member of the Executive Committee of the Turkish National Pediatric Society and Vice President of the Pediatric Emergency Medicine and Intensive Care Society in Turkey. She's a member of the Extending Executive Committee and Pediatric Emergency Medicine branch of the European Society of Emergency Medicine. Dr. Teksam is also an active member of the International Pediatric Association in the Strategic Advisory Group on Children in Humanitarian Emergencies as the co-chair. Good morning, good afternoon, good evening, Dr. Teksam as well. And to Dr. Teksam, the time and screen is yours.
Thank you very much. Thank you. Good afternoon, good morning, good evening. Thank you. Nice presentation. So, first of all, I would like to thank to International Pediatric Association, Professor Dr. Hasanoğlu and Dr. Aman Pulungan for this valuable organization of this webinar. And thanks to all speakers and of course all attendees as co-chair, Humanitarian Emergencies co-chair. So now I would like to present first speaker, Dr. Syed Ali Shah Alavi. We can move the, yes. I would like to present Dr. Syed Ali Shah Alavi. Dr. Alavi is Associate Professor of Pediatrics, member of Executive Board of Afghanistan Pediatric Association, Senior Child Health Advisor in Urban Health Initiative Afghanistan, Chair of National Certification Committee for Polio Eradication Afghanistan, Chair National Immunization Technical Advisory Group Afghanistan, and Consultant Pediatrician in Melat Medical Complex Afghanistan, member of Child Protection Action Network Kabul, Afghanistan, and past president of Afghanistan Pediatric Association. For the past 30 years, he has been involved in many programs, projects related to child health in Afghanistan. I would like to present Dr. Syed Ali Shah Alavi for his presentation titled Healthcare Needs of Refugees in Afghanistan. Yes, Dr. Alavi, we are on your talk. Please, thank you very much for your presentation now.
Can you hear me?
Yes, yes, please go ahead.
Next slide.
Yes, slide is moving. No problem, thank you.
Okay, this is the general information for the Afghanistan. The total population is about 41 million. Childbearing age women is about 10 million. Under 5 children, about 7 million. And under 18 is about 18 million. And the people in need of humanitarian aid, this is a projected figure, about 24 million. Yes, next slide, please. Oh, the main causes or reason for this internal displaced people and also refugees in Afghanistan are 4 decades of violent conflict and insecurity. The main reason, besides these natural disasters, especially climate change, drought, flood, and so on, and the spread of COVID-19, they are the main causes of the internal displaced people. Next slide. Okay, these kind of conflicts and also war conflicts, beside this, the drought, flood, and climate change causes that the most of the people, they are not able to meet their basic needs. Especially the sanctions increased and also raised this problem. More than 5 million internally displaced people in Afghanistan, and 78% of them are due to insecurity and also conflict. About 300,000 of these internally displaced people are living in shelters and open spaces. And these conflicts and also challenges faced the children, about 1 million children, to the severe malnutrition. Next slide, please. What are the main challenges of the refugees and children and also in internally displaced camps? Living in shelters, low access to education, and sometimes no access to education, low access to healthcare services, food insecurity, low access to safe water, hygiene and sanitation facilities, forced labor, child and armed forces. Also this challenge, street working children, child abuse, violence, begging on the street, child marriage, child stealing, separated children, and also children with disabilities. Next slide, please. Okay, this one photo from IOM. Next slide. The health problems for the refugees children in Afghanistan, mostly they are suffering from diarrhea, dysentery, pneumonia, measles and whooping cough outbreaks, TB, malnutrition acute, unwanted pregnancies, psychosocial disorders, PTSD, and some of them skin diseases. Yes, next slide, please. Okay. We have in Afghanistan two packages for the health services is approved from the Minister of Public Health, and also they are implementing by NGOs. One is the basic package of health services for the primary level services, for the secondary and also referral level. For the primary level, these BPHs include IMNCI, EPI, reproductive health, family planning, TB, malaria, HIV, and also mental health and community services. Mostly for these refugee camps or these internally displaced people, they are providing these primary level services that is included IMNCI, RH, family planning, mental health, and emergencies. But due to the shortage of human resource and supply in medicine, they are facing many challenges and also problems. Next slide, please. Okay, whatever I present here, I collected all of them from the Minister of Labor and Social Affairs because they are working for the Child Protection Action Network, Minister of Public Health, Emergency Preparedness and Response Department, and also International Rescue Committee, and also International Organization for Migration. They are the main challenges of the refugees and also the main challenges for the health of the children who are living in internally displaced shelters and also camps. I think that they are very short and also brief presentation from our side. Thank you.
Thank you, Dr. Alawi, for really good presentation. As you know, the United Nations High Commissioner for Refugee estimates that 2020 about estimated 35 million of 42% out of 82.4 million displaced people, children below 18 years. And over 1 million children were born as a refugee. And I think this is quite serious. So what happened right now, about almost 2.5 million, more than 2 million people right now as a refugee from Ukrainian to Polandia. So we would like to hear from the expert, our expert from Polandia, and the topic will be humanitarian needs and organization for refugee in Poland. Yeah, I would like to read also the CV, Dr. Igor Winnicki. I hope I pronounce your name right, Igor. And
you're excellent. Thank you. Thank you.
Doctor of Pediatric and Public Health, member of Executive Board of the Polish Pediatric Association, medical director of the Praski Hospital in Warsaw. Praski, right? Senior lecturer in the University of Rzeszów, past Deputy Minister of Health, Republic of Poland, and past member of Executive Board of the President of the National Center for Research and Development, past President of National Council for Drug Prevention. So he's a really important person. He was the chair of UNAIDS program coordinating board in 2012, and he has chaired the 31st meeting of the UNAIDS PCB in October 2012, the head of international delegation of UNAIDS program coordinating board field visit to Ukraine. So he's a really expert person, and he knows what's going on right now. So over to you, Igor. Please, the time is yours.
Thank you very much, Mr. Chairman, ladies and gentlemen. First of all, I would like to thank you very much for inviting Polish Pediatric Association for this prestigious scientific meeting, and thank you for Polish Pediatric Association to nominate me personally as a person representing our society during this webinar. I would like to ask you if I'm doing right with sharing my presentation. I hope it's visible on your. Yeah, that's it. Okay, is it fine? Okay, so sorry. Okay. I would like to start with the statement that the refugee crisis, which is caused by Russian Federation's attack on Ukraine, has already reached the dimensions of the largest migration crisis of asylum seekers since the Second World War. This is really the newest data according to the UNHCR, that stands that more than 3,700,000 people were forced to flee Ukraine until yesterday, and 2,200,000 of them have entered our country, Poland. So this is the biggest refugee crisis in Europe, which already outnumbers twice as much the last migrant crisis in 2015. To understand and to make you more familiar with the challenging for healthcare and delivery system of our country and other European countries, let me please briefly look through the main demographic measures and health measures comparing Polish population and Ukrainian population. As you can see, the Ukrainian population is more or less 10% bigger than Polish population, with the same structure of demography. That for our as pediatrician, what is most important in both of these population, 18% of the society are the minors. But if you will look on the measures of health quality in these two populations, you will simply realize that the negative measures are elevated in Ukrainian population even before the war started. So, for example, the prevalence of stunting in children under 5 is estimated in Ukrainian children to be as much as 15.9%. And the same condition is visible in 2.3% in Polish children. The infant mortality rate is 6.94 in Ukraine, and then is 3.74 in Poland, while the richest countries in European Union tends to decrease above the level of 2 per thousand. One of the most challenging aim to enhance and to provide the possible good quality of healthcare for these population is to increase the number of immunization coverage. Before the war, taking as a first example the Dtp immunization coverage. So this is the percentage of the 1-year minors who have been vaccinated at least with 3 doses of Dtp vaccine. In Ukrainian population is like 80%, while in Polish population is 95%. Polio third dose in Polish population, this indicator we can see in 87% of Polish minors, while only in 78 in Ukrainian minors. And since the COVID-19 vaccine was implemented and invented into the state public vaccines programs in both countries, we noticed that 59% of minors in Poland are already vaccinated, but in Ukrainian population, the general population is 37%. Probably the one of most challenging assets and goals for national healthcare delivery system will be enrolling the population of people living with HIV virus into the national treatment program. While these have been already done in Polish population, which, by the way, has the very small extent of the HIV, people living with HIV, which in Poland is approximately 35,000 of people in the 37 million population. So the incidence rate is really low in our country. And the antiviral therapy enrollment in Poland is almost 100% of these who fulfill the criteria of treatment. While if you will look on the data according to the Ukrainian population, you will realize that there is a huge number of 260,000 people living with HIV in this country, with the only 57% of these who receive antiretroviral therapy. Already we have done first measures to combat this problem. As you can see on the left side of this slide, there is the official website of the Polish National AIDS Center, which is the agenda of Ministry of Health, which started the dedicated program for Ukrainian population, refugee population in our country, with the Ukrainian language, precise information how to get to the therapy and how to find the healthcare facilities that provide this therapy. In Polish program, of course, people get the medicinal products, are being supervised, the medicinal products directly into the hand in healthcare facilities. But the most challenging problem now is to find these patients and to link them with the proper healthcare facilities to enroll them, in fact, into this program. The next problem which I would like to highlight is the tuberculosis incident, which varies significantly in these two populations. As you can see, in Ukrainian population, the incidence rate is 73 per 100,000, while in Polish population is 9.6, the rate. And what is very important is the treatment coverage, which in general in Poland is estimated to be 87%, while in Ukraine is 55%. And very important and dangerous healthcare phenomena is the extent of the drug resistancy and strains of tuberculosis identified in these both populations. So in Poland, it's slightly increasing, but it's still a small amount of 2.2%, while in Ukrainian population is 29% in new TB patients. So these are challenges of infectious disease. Okay, so according to the WHO, the most important is to take essential measures, especially for health services, to enroll these refugee population with the treatment of chronic non-communicable diseases, including diabetes, cancer, rare diseases, cardiovascular diseases, neurological diseases, to supervise these population with social services, maternal and child healthcare facilities. For example, to supervise this population to free access to primary healthcare institutions, and to, on the national level, to make them to be entitled, which is already done since 3 weeks, to the national healthcare reimbursement system. So in fact, the medicinal products which are listed on the reimbursement list are being supervised, are being provided to the refugee population with the same level as for Polish population. That in fact causes that these essential drugs are affordable for these people. We have already implemented the comprehensive integration programs according to the knowledge taken from the United Nations and international institutions, according to the accommodation, the access to Wi-Fi, the launching the childcare and education. There is a huge problem in Poland currently to build the essential capacity of primary and secondary school to enroll these children. We are discussing in country how to arrange the education in Ukrainian language according to needs of this population, but also how to integrate the children and how to make them to learn Polish and then to fulfill the Polish criteria and the Polish path of education. Access to healthcare infrastructure, social assistance, psychological assistance, to labor market, which was already done. Citizens of Ukraine are fully entitled to apply for legal work in our country. Assistance in obtaining occasional and temporary work, and also access to help in contact with loved ones. In Ukraine, for example, the phone calls from Poland to Ukrainians are officially free of charge. This all was done due to European Union Protection Directive, which was already implemented in Poland with the act and assistance of the citizens of Ukraine. And for example, these are 6 points from which the temporary protection means consists of, which is the residency rights, which is access to labor market, which is access to housing, which is access to social welfare assistance, fully access to medical assistance. And the agreement and unaccompanied children and teenagers are entitled to legal guardianship in our country, which is really essential because there's among the 800,000 of minors population who came to our country already, there's a huge amount of orphans. So it's really important to legally support this population. So what are probably the most challenges for local authorities and central authority in our country and other European countries is for firstly hosting. What are we witnessing right in Poland is an incredible mass action of charity, of civil society. So average people very often they offer their cottage houses or even rooms in their private flats to invite host refugees from Ukraine to their homes for provisioning arranging the medical care, because on the legislative field it was already done. But what is really challenging right now is to finding these patients, to linking them to the healthcare system, to showing them how to access the system and to teach them how to use the healthcare delivery system in Poland, which is not really as easy as we would expect to be, regardless the communication barriers, because the language is the culture is very similar, but people just don't understand each other simply without translation. And state support and individual initiative. I think I'm running out with my time, so I'd like to thank you very much for your attention. And here are some take-home messages that generally, regardless Polish and Ukrainian situation and boundary in refugees population, there is always the same problems, which we could again and summarize with these 4 points. Thank you very much for your kind attention and once again for your invitation.
Thank you very much, Dr. Igor Radzewicz-Winnicki, for your impressive presentation. We hope that the war ends soon and children no more harm in Ukraine and of course, all around the world. So these conditions is very hard for you, for all healthcare, and of course, refugee children. So we are moving on. Next speaker, I would like to present next speaker from Turkey. So it's my pleasure to present her, Professor Dr. Elif Özmert from Turkey. I would like to read her CV. Professor Dr. Özmert received her medical doctor degree from Hacettepe University Faculty of Medicine in 1998 and completed her residency training in the same institution in 1994. She received her PhD degree in social pediatrics from Hacettepe University Institute of Child Health in 2000. Since 2003, she is working as professor of pediatrics in Hacettepe University Faculty of Medicine, Department of Pediatrics. She has been the vice director of Hacettepe University Institute of Child Health between 2004-12 and associate dean of Hacettepe University Faculty of Medicine between 2009-12 and head of Department of Pediatrics between 2015-2021 and currently the director of Hacettepe University Institute of Child Health. Yes, again, it's my pleasure to present her. I'm sorry, she was certified as a developmental pediatrician in 2012. She is the Deputy Secretary General of Turkish National Pediatric Society since 2015. She is author to more than 118 international national article or book chapter, and her specific areas of research and study are nutrition, environment, development, and developmental disorders. After the Syrian refugee crisis in Turkey, she is also actively working in the area of refugees with the Turkish National Pediatric Society. So now it's my pleasure to present her. Dr. Özmert, please, we are listening you. Sorry for that.
Dear moderator, thank you very much for the kind introduction. And also, I would like to thank IPA and the Humanitarian Emergencies SAG for the organization of this webinar and for inviting me. I would just like to try to summarize the activities of the Turkish National Pediatric Society related with the child refugee in Turkey. Well, as we have mentioned, the wars have changed, and now the wars are much more in the urban areas, with killing many civilians and many children, and disrupting the infrastructure and disrupting schools, hospitals, and also even disrupting humanitarian aid activities, which just increases the burden of the war on the civil population. And as I have mentioned, currently the official numbers are mentioning about more than 80 million forcibly displaced people, and most of them from the Syrian Republic, and most of them being hosted in Turkey. But unfortunately, these numbers will be just changing with the Ukrainian refugees and hosting them with Poland probably. And as we know, most of them are also the children refugees. I mean, only the 30% of the world's population are children, but 42% of the refugees are already children. And we also know that these are not the real numbers. Maybe there are many numbers that we don't know: how many children are killed, how many children are made soldiers, and how many children are made just being involved in sexual abuse. And we don't have a comprehensive understanding of how the children will be affected at the end of those wars related to malnutrition, infection, educational delay, and heightened poverty. So we know that somebody has to act. The United Nations and the sub-bodies have to act, the governments, the NGOs have to act. But now we are going to talk about the pediatric societies and pediatricians acting. Well, the founder of the Turkish Republic has stated peace at home, peace in the world in 1931. And then we have the establishment of the Turkish National Pediatric Society. and the ratification of the Turkish Republic of the CRC, and unfortunately the civil war in Turkey, in Syria in 2011. And currently, Turkey is hosting more than 3.7 million Syrian refugees. At the beginning, they were mostly in the camps, but now only 1% are living in the camps, and they're just living in the society. And again, near half of them are children. The population of 1.7 million are children. Well, we are also using the temporary protection status for the Syrian refugees, so they gain access to all kind of public services, the health, education, social and legal assistance are given free of charge after they are given a provisional identity card and having just passed the registration procedure. Well, they have the humanitarian needs with water, sanitation, hygiene, health, nutrition, mainly the infection, injury, malnutrition, reproductive health, chronic diseases, and mental health issues. And besides that, they need education, protection. Adolescents have to be just acted differently, and also the external communication and advocacy. And the Turkish Republic has spent more than $80 billion on this issue, and EU has funded around 6 billion euros for the refugee population. So the Turkish National Pediatric Society decided to take action for the refugees in 2012, and we decided we have to work with the pediatricians and also work with the families, children and adults differently, mainly on the subject of training, advocacy, and research, both for the pediatricians and for the families. Turkish National Pediatric Society has organized 12 courses related to the refugee health problems, mainly in the cities that are near the Syrian border, and just discussing the infectious diseases, malnutrition, and psychosocial issues. And also the branches of the Turkish National Pediatric Society has organized activities in the camps near the Syrian border for the psychosocial support of the children. And then as a Turkish National Pediatric Society, we started a collaboration project for the refugee with IPA Foundation in Cevdetiye tent camp. First, we made a need assessment visit, and we talked with the families living there, with children, with adolescents, with mothers, and also those who are just providing services, physicians, nurses, midwives, social workers. And after this visit, we decided to, we made another visit, and we have training sessions with the families. And also we had sessions with the adolescents about the pubertal health problems and their psychosocial issues. We have seen that they really had a problem about the newborn care, but the vaccination and breastfeeding has a high acceptance rate. And also they had some issues with vitamin D and iron supplementation. Besides, meanwhile, we were also just planning a social awareness raising project, because we have to, there were issues related in the host society. And with the help of the famous artists and football players, we made a social media campaign with the tagline, "Everything starts with love." And also this campaign was also important for advocating the Syrian refugees in the population. Then we conducted a international mental health workshop, and also IPA again visited the camps in Gaziantep also. For the international mental health workshop, there were more than 200 participants from Jordan, USA, Turkey, Kosovo, Iraq, and also several international societies, IPA, IPAF, Save the Children, International Association for Adolescent Health were among the speakers of the workshop. And also we put the report in our website. As we have said, the numbers are, not correct. We also need new evidence, new numbers. So we also conducted research. The first one was at our first visit to the camp about the psychosocial problems of the adolescent. And as at that study, we showed so that if the duration at the camp just increased, somatization and hostility scores were also increasing. Again, if they have lost a first-degree relative, they also have higher somatization scores. 3 years later, we just conducted the same study at the same camp, but for different adolescents. We have seen that really the global severity index score has decreased. But again, the scores were related with the duration of their stay in their camp, especially the depression scores. And also the girls had higher scores compared to boys. Also, we have conducted a study with the nutritional status for those in the Turkish population, the ones who were living in the society and the ones living in the camps. And we have seen that the Turkish population had higher underweight and higher obesity percentages compared to the Syrian refugees, and also the Syrian refugees living in the camps had a higher percentage of overweight status, but the Syrian refugees in the urban areas, they had better scores. As a result, we just made another paper that has been published in Pediatrics, and we have tried to emphasize all the efforts that we have put forward, as just mentioning again, the pediatricians, the families, training, research, and advocacy. Meanwhile, the International Society of Social Pediatrics and Child Health had made the Victories Declaration, and at that declaration, it has just emphasized that pediatricians and child health providers and organizations have a leadership role to play in fulfilling the rights and the needs of the children on the move. I wish we will not have to do these webinars again, and I wish that we have all our children in a better situation. But during that time, peace at home, peace in the world, everything starts with love, and please leave no one behind. Thank you for your attention.
Thank you so much, Professor Osmer, for really nice presentation. And I would like to invite our next speaker, Dr. The topic is we're talking with children about war and other humanitarian crises. I think this is the most difficult thing. How should we explain it to them? And I think this is not really easy, even as a pediatrician. So we have the expert today, Dr. David Schoenfeld. Dr. David Schoenfeld, MD, FAP, established and direct National Center for School Crisis and Bereavement, located at Children's Hospital Los Angeles. He is a professor of clinical pediatrics at Keck School of Medicine. Prior faculty positions have been in the Department of Pediatrics at Yale University School of Medicine. And he's also head of the section of developmental and behavioral pediatrics at Cincinnati Children's Hospital Medical Center, and pediatrician-in-chief at St. Christopher Hospital for Children, and chair of pediatrics at Drexel University School of Medicine. Over to you, Dr. Schoenfeld. And also, for over 30 years, he has provided consultation and training to school on supporting students and staff at time of crisis and loss in the aftermath of numerous school crises, events, and disaster within the United States and abroad, including the COVID-19 pandemic, terrorist attack of BTC, 2001, school and community shooting and stabbing in Santa Clarita, Parkland, and all other states. And even during the New Orleans, Katrina. So Dr. Schoenfeld also speak with over 1,000 presentations. So we can see quite a long CV from Dr. Schoenfeld. Over to you, David, please.
Thank you very much. So you can actually put on the first slide. And I'd like to begin by thanking the IPA for both doing this webinar and for inviting me to speak. And I was asked to talk about and give some practical suggestions. You can actually go on to the next slide about how you can talk with caregivers about how to talk with their children about wars and other humanitarian crises. And so first off, we just have to acknowledge we need to talk with them. Being silent about a crisis isn't going to protect children from what happened. It'll only prevent them from both understanding and coping with it. And not communicating can actually increase their anxiety because it can lead children to imagine that there are even more dangerous and personally threatening events about to occur. I remember talking to a parent. This was in Colorado some years ago. There had been a shooting in a movie theater where over 80 people were shot and about 12 of them were killed. And her child was just about to turn 5, I believe. He was not yet in kindergarten. And they decided not to discuss it with their child. So they blocked all communications, they turned off the television, they didn't talk about it when he was present. And then one night at dinner, they suggested going to see a Disney film. And the child simply said, "I don't think we should. There's someone in movie theaters killing people." And they found out he had heard when he was in the public pool while he was swimming from another child. And what bothered her most was not just that her child was worried about what had happened, but that he didn't feel safe talking to her about it because she hadn't discussed it with him. So we should begin by asking children what they already know when these are in the news. And this information may come from television, the internet, social media, school friends, or just being overheard by adults speaking. And much of their information may not be accurate, and they may, or it may have been accurate information, and they may misunderstand what they heard. And as children explain to you what they know about the situation, that's when you should look for misinformation and misunderstandings, especially if they may be causing concerns in children. Now, children and youth of different ages and developmental stages react differently, not only because of their developmental age, but also their unique personal experiences, their personalities, and their own coping styles. But the amount of detail that children will find useful varies greatly. The older the child is in general, the more discussion is going to be needed to answer their questions and address their concerns. But really, no matter how old they are, you really want to start with basic information in simple and direct terms, and then ask them questions, ask what questions they have, and use that to guide your further discussion. You should avoid exposure to graphic images and repetitive media coverage. While it's useful for children to know enough to feel that they understand what's happening and what they should do, it isn't helpful for children, nor for that matter for adults, to be exposed to graphic images, excessive or detailed information, or just continuous and repetitive media exposure. Evocative interviews of those who were injured or the families and friends of those who have died, even if they don't contain any violent images, may actually still be very upsetting to children. It can trigger feelings of grief for children who've experienced the death of a loved one, even if it's unrelated to violence in their own personal experience. And the COVID pandemic, for example, has left many children with such losses and makes them vulnerable to hearing those interviews. We go on to the next slide. It's good to remember we should all watch our media consumption. So make sure it's a healthy diet and don't consume too much of it. It's helpful to explain to others and to remind to ourselves that there really are only two main reasons to watch, listen to, or read media coverage during a crisis situation. One is to be reassured, and the other is to learn practical steps that we can take to keep ourselves and those we care about safe, or at least safer. So if you're watching, listening, or reading coverage of a humanitarian crisis, and you aren't becoming reassured, and you aren't learning new actions to take, then it's time to disconnect from media for at least a period of time and connect instead with family and your community to offer reassurance and support. We go on to the next slide. Now, as we talk to children, it's important to remember that we can't assume that their worries are the same as our own. We can't provide effective reassurance to people of any age, in fact, until we know specifically what concerns they have. Otherwise, we are telling them what we feel is reassuring to us, but we're not actually providing reassurance for what worries them. You want to provide honest explanations and correct misunderstandings or misinformation, but don't ignore or minimize the concerns that children voice. Help children identify ways to cope with anxiety, sadness, and fears, rather than pretend that they don't or shouldn't exist. Now, when we listen to children and come to understand their feelings and worries, we can better help them make sense of the experiences and how they affect us all. I remember my youngest daughter was about 9 when the World Trade Center attack occurred. One of her friend's mother actually commuted to the World Trade Center. And as the things unfolded, there were a couple things that she mentioned to me she was concerned about. One, she was worried that as we were bombing Afghanistan, that they had nuclear capacity. That was because she had overheard something on the radio about a country in the Middle East that had where we were concerned of nuclear capacity. She also was concerned that the planes, passenger planes flying overhead, might drop bombs by mistake because she knew that there were bombs being dropped by planes. Once she told me what she was worried about, I was able to provide reassurance, but I assure you, I wouldn't have known that was her concerns unless she had told me. So we do realize that crises remind all of us that we're never completely safe, but now is actually the best time to reassure children that they should feel safe in school, in their home, and the community, and explain why that is. If you go on to the next slide, it's important to remember some children are going to be impacted more than others, and they may need greater assistance. If children have family or friends in the area experiencing the crisis, of course, the news may feel very close to home. But even children who have none of those personal relationships to anyone directly impacted by the crisis may also have troubling reactions. For example, children who live in communities characterized by high rates of violence may become more concerned about their own physical safety when they hear about war elsewhere. Those who are part of communities that have experienced racial discrimination may feel an increase in distress and anger when they hear about acts of aggression and bias, even in other countries far away. Children who have experienced poverty or food insecurity may feel anxious when they hear stories of families with limited food or limited money to attend to other basic necessities, even if it's in the aftermath of a natural disaster. News reports and stories may be triggering for children who have themselves survived wars or other humanitarian crises, or whose family have experienced refugee status in the past. And of course, children who have challenges with anxiety or depression at baseline are more likely to benefit from additional support. If you go to the next slide. All children and adults may wonder what could have been done to prevent a humanitarian crisis. Even when it is obvious to adults, there's nothing children could have done to prevent the crisis. Children may still feel helpless and wish they could have changed what has happened. Let children know that this is a common reaction. We all wish that there's something we could have done. In addition to these feelings of guilt, it's natural to engage in thoughts of blame in some ways. In some ways, this blaming may actually help you feel some control of uncomfortable feelings and diminish a sense of personal risk. But when individuals and groups take aggressive action against those they deem responsible, their actions are often misdirected and harm innocent people. Children and adults may focus on people who seem easy to identify for blame, such as people who look like they might belong to a group that includes those who are responsible. And this misguided blame doesn't ease the immediate feelings of grief and fear, and it complicates and worsens matters instead of providing solutions for the future. We should remember, as we're talking to children, that children and teens are often very concerned about themselves. And when there's a crisis, they may become even more concerned about what affects them personally. So they may act immaturely, and sometimes adults see this as being selfish or uncaring. We should expect children to think more about themselves for the time being after a crisis. Once they feel reassured that they're being listened to and that their needs will be met, they're more likely to be able to start to think about the needs of others. And once children start to feel safe and understand what's going on, many will want to help, and we should find appropriate ways they can provide assistance to others. Now, often what children and teens need most is to have someone they trust listen to their questions, accept their feelings, and be there for them. If you go on to the next slide. Adults shouldn't worry about knowing the perfect thing to say. There's actually no answer that's going to make everything okay in the context of a humanitarian crisis. Listen to their thoughts and concerns, answer their questions with simple, direct, but honest responses. Provide appropriate reassurance and support when you're able. Children may ask questions about why something like this could or did occur, even when they don't expect adults to have the answers. Just like adults, they may pose rhetorical questions. Sometimes the best answer for caregivers is to acknowledge the situation seems unfair, give them a hug, or simply sit and listen with them in silence. Children may show some distress when talking about a distressing situation, and adults may also demonstrate some distress. So it's helpful for children to realize it's okay to show others when they're upset. Otherwise, they may think they're supposed to hide their feelings, and then they'll be left to deal with them alone. Caregivers should share their own feelings and model positive ways they cope with them. When a crisis results in a lot of death and destruction, it's natural for people to be upset. However, if children continue to be upset for several days, they seem unable to cope with their fears, or they're having trouble in school, at home, or with their friends, it's a good idea to speak with someone outside the family for advice. And caregivers may wish to speak with a teacher or school mental health professional, their pediatrician, or a community mental health professional. Please remind families that they don't need to wait until children need counseling. They should take advantage of counseling and support whenever they think it might be helpful. So if you just go to the next slide, I'm just going to show you some resources and end. If you just advance to the next slide, if you can, you'll find 3 different websites here for the National Center that has a guidance document on how to talk to children, Coalition to Support Grieving Students, and the American Academy of Pediatrics website. And on the last slide is just the take-home measures, which for the interest of time, I'll just post, and I'll let, we can turn it over to questions there. Thank you.
Thank you very much for this impressive and sensitive speech, Dr. Schoenfeld. Yes, and thank you very much to increase our awareness how we talk during the humanitarian crisis with children. So I think we have to move Q&A session. So we have lots of questions for the speakers. So we chose some of them for you. So we can start, I think, Dr. Klungan. Yeah. So yes, we have some questions for the first speaker, Dr. Alavi. Yes, first question is, how can we address more efficiently to the health problems of refugee children since we are facing the first time this issue from Romania? Dr. Smaranda asked to Dr. Alavi. Dr. Alavi, do you have any comment for this question?
Yes, thank you, Dr. Sepp, for this good question. Yes, for the effective addressing effective services for the problems of the refugee children, I think that a strong coordination among the partners is very important, and also donor community support. I think they are main points that can support, yes, the children in this situation.
Okay, is there any comment of this for this question among any other speakers?
Can I just shortly make a comment? I mean, well, it will depend on where the children are living. I mean, if they are in the camp, and what are the infrastructure of the camp? Are they in the society? So just addressing the health problems is not something related with the health system. It also has its roots in the infrastructure also, as well as in the malnutrition. So, but as the pediatricians, we also, when we first time had the refugees in Turkey, they had some health problems that we were no longer encountering in Turkey. So having training, having new training programs among these issues were also very effective for the pediatricians and also for the family physicians, or I don't know how is the health system in Romania, so who is going to give the primary service to those children, I don't know, but it will be very important to make some training sessions just related to the health problems of the refugee children, and also the infrastructure is also very important, because crowding, not have a lack of water and sanitation services, they will all increase the problems. And as Dr. Igor has mentioned, and there's also another question related to immunization, that is also very important, and maybe we can just further talk on the immunization services when that question comes. Thank you.
Thank you, Dr. Özmert. I think it's very important the refugee children where come from and where they go. I think this we have to analyze this issue. So if there is no any comment, I would like to move to the second question. So whose responsibility health fund for the children refugee when you live in such developing country, Dr. Alavi? I think this is very problematic. Funding is very problematic problem. What do you think?
Yes, the funding is the main responsibility of the government, but you know better than this is the new government, and also there are shortage of the fund, especially for the health sector. On the other hand, we are facing the withdrawal of the donor community from the Afghanistan. Is another challenge. But however, right now there is some support from the government, and also some support from the donor community. But I think that about 75% of the fund is coming from the community, and also from the household people. their out-of-pocket expenditure is.
Okay, thank you. Dr. Özmert, would you like to say something? Because in your presentation,
Yes, well, as Dr. Alevi has mentioned, the funding is mostly, it becomes the responsibility of the host country. Yes, there will be some international funding. Turkey also received international funding, but as I've mentioned about the numbers, when we just make a comparison, most of the burden was on the hosting government. So
yeah, thank you.
I wish the international funding is much more for all the countries who are going to host the refugees.
Yes, as pediatrician, we don't need to think like this funding actually, but we have to provide excellent healthcare for also refugee children, but funding is very problematic issue. Dr. Igor, would you like to say something?
Yes, because this is really essential. I would say that even in highly developed international community of Western European countries, there is a huge problem raised already to creating a funds for combating the health problems of the refugees as a consequence of the war in Ukraine. And it's obvious. So regardless the capacities of local healthcare systems, because of course Polish pediatricians have gained a 10% of new pediatric population, because approximately according to Polish pediatric, 7 million of Polish children, we are hosting 800,000 new children living in Poland. And this increase is for sure will be causing in future the paucities of funds. But instead of this very short period, we do realize that arranging a dedicated funds on the EU level is essential. And I would say that in cases, because the person who raised this question have indicated the problem when the hosting country, in fact, is a developing country with the for sure funding paucity. So I would say that this would be responsibility for international audience actually, and probably the UN should, or WHO should intervene and organize essential funding for combating the health problems, because we have to realize that very quickly and precise healthcare intervention for the refugees population is in fact preventing the outbreak of epidemics and worsening the health condition, not only from refugees, but also the host community. So this is really essential. And it might not be left just as many politicians would like to leave it as a problem of the local authorities, because they won't be able to face the problem without the help of international community. And that's one thing.
Informasi ke kondisi para pengungsi anak.
Dr. Texam, we have, I think, another 7 minutes. I think we have to go to the next slide for special for Dr. Igor. Yeah, yeah. Dr. Civics, I think there are a lot of questions. I think, can you answer that? I think the first one, does Poland screen aids and organization providing humanitarian assistance? What are the criteria? I think this is the first one. And the second one, I think, how are the children record maintained? I think this is a good one. And the other one, how we can increase the possibility of doctors who wants to join the organization for refugees? Is it possible? And the next one, how is the current progress of impact of financial? This is already discussing. I think you don't have to answer that. But what illness do the refugee children usually suffer? Maybe this 3-1, I think you can answer it, Igor.
Yes, first of all these children, actually all refugees have been already enrolled in the Polish official state healthcare delivery system. So all these people are already entitled to go to any public healthcare facility and to get essential health they need. We're trying to avoid organizing the refugees centers, which is trying to relocate this population in a variety of towns and cities in Poland to find the flats and to make them to feel much more comfortable in our country. So there is actually no need for special healthcare screening, because they just go to healthcare facility and then fulfill and they're enrolled in the normal routine healthcare activity in the place they live. So in the new settlement. And what is really essential, that this population is also entitled for the labor market, and because of the many places for work in Poland, it's much more easier because they will find easy work in our country. So there are no special criteria for health screening for this population, because there is no necessity actually. Because if they go to primary health care, they would be diagnosed and they would fit. They would be put in special paths if needed. So they have free access to secondary and tertiary medical care if needed, of course.
Any other possibility that other doctor from other country can join you, or
Yes, of course. Yes, of course. One of the achievement of the special act that I mentioned here is enabling Ukrainian doctors who originally come from non-EU country, because there is the very specific conditions for medical workers willing to perform the professions in the EU countries. So there is a huge exception made, and every healthcare professional trained outside of European Union, basically particularly in Ukraine, who will come to our country as being refugee, of course, is entitled to perform their profession in our country. It is really also essential because these people speak Ukrainian language, we don't. So we have Ukrainian nurses and Ukrainian doctors already implemented in our system.
Okay, thank you, Igor. We don't have enough time, so I think we have to go to the question for Dr. Osman, please. The slide for Dr. Osman, please. Yes, I think this is quite a good question that people would like to know. How does the Turkish National Pediatric Action Model work, and how are the opportunity to implement the model in other countries? This is the first one. This is really good. And the next one, I think, number 4, what point we need to see in order to apply your model in the country? This is the same thing as number 1. And I think, how is the COVID vaccination in refugee children? I think these 3 one. I think after that, we have to go to Dr. Skonfer. Please, Dr. Osman.
Well, thank you very much. In fact, the model that we have just put forward is, just not something very much new, but they were the steps as a Turkish National Pediatric Society we have taken while we were just hosting a lot of many children, and while our pediatricians have come under a very increased burden. And as it has been asked, while they were encountering some diseases they were not routinely treating, so it is important that we also wanted to emphasize that as the national pediatric societies, we can just put some effort in this issue, because we already know that the government has been organizing the infrastructure of all the services for the children. So it is not something just separated from the government, but we have to put also some help to all the governmental work that has been done, and we have to work especially for the pediatricians as well. In order to apply this for the other countries, I think that the motivation of the National Pediatric Society and both the financial issues of the Pediatric Society is important. And here I would once more want to thank the IPA Foundation that also has supported those projects but in collaboration with the Turkish National Pediatric Society. Well, for the impact of all those services to the refugee children in Turkey, well, we, as I've just mentioned, one of them, we know that they are in a better situation, but we also know that they still have problems. Especially psychosocial health problems is much more than the hosting population. But for the physical issues, we don't have very different percentages. And what else should I answer from those?
I think it's okay. Yeah, we have to go to, thank you, Dr. Osmer. We have to go to the question for Dr. Conwell. Next, please, because we run out of time. Maybe this is a really good one, David. Number one, the need to be included in school curriculum. From what age can children be invited to talk about war and health issues? This is the first one. And the next one, I think number three, what we can do as a doctor to help them in refugee shelter. And the next one is number five, how psychomotor development is measured in this type of population. Yeah, I think
Okay, so
these three, I think, please.
yeah, I'll go quickly. So first off, in terms of who to include in talking to children, I would say children at any age where they can have conversations. So by the time they're in school, I think you definitely can talk with them. It may be a very simple and basic conversation, but you can certainly start by talking with them. And for younger children, they may wish to process some of their thoughts more through drawings or through artwork or other expressive techniques. In terms of what we can do as a doctor to help them in shelter, refugee shelters, I think we can help adults help their children is one thing, and make sure that they're given something that they can do that allows them to talk about, process, and express their feelings, and make sure that we're helping them feel safe, at least while they're in the refugee shelter, that they feel secure, that they feel comforted, and they feel supported. In terms of how psychomotor development is measured in this type of population, I think it will be measured in the same way you would measure it if they were not refugees, but you do need to understand that in situations of high stress, children often do not perform as well on any type of whether it's psychomotor development or any type of psychological testing. So they may not be functioning at their highest level. So I would be cautious about making certain conclusions about their development if you're doing testing in the middle of a war or crisis situation.
Okay, thank you, David. I think we ran out of time. Over to you, Dr. Texam. Maybe you can close our webinar. Please, Dr. Texam.
Yes. Thank you very much for all speakers for this nice speech, nice talk. We don't want to, we have to provide healthcare for all children, all refugee children in the world. Yes, thank you very much for your efforts, for your research, studies, for everything. Thank you very much. Thank you very much for your attention, and thank you very much for all attendees for the this webinar. Thank you.
We extend our warmest round of applause and appreciation to our four honorable speakers and, of course, to our moderators, Professor Pulungan and Dr. Texam, for the incredible and eye-opening discussion. As a token of our gratitude, we will now present certificates to our honorable speakers who have contributed greatly to our learning process today. To present the certificate, we now invite Professor Enver Hasanoglu, Professor Aman Pulungan, Dr. Texam, and Dr. Abdul Salam Abdulibdeh to the screen. To our speakers, kindly turn your videos on and smile as we spotlight you alongside your certificate. First, we have Dr. Syed Ali Ashah Alawi. Thank you very much for your contribution today, Doctor. We will now be taking the photo. 3, 2, 1. 3, 2, 1. 3, 2, 1. Thank you very much, Doctor. Next, we have Dr. Radziwick. We will now spotlight you to take the photo together with our honorable. 3, 2, 1. 3, 2, 1. 3, 2, 1. Thank you very much, Doctor. We now have Professor Eliv Osmart. We will now spotlight you to take the photo with the certificate. 3, 2, 1. 3, 2, 1. 3, 2, 1. Thank you very much, Professor. Last but certainly not least, we have Dr. Schoenfeld. We will now take the photo, Doctor. 3, 2, 1. 3, 2, 1. 3, 2, 1. That concludes the certificate presentation session. And of course, no event is complete without a photo session. We now invite our honorable guests, speakers, and moderators to once again turn your videos on as we will take this group photo. And to all the participants as well, kindly turn your videos on. We will take a group photo with all our distinguished speakers, moderators, and guests. Let us give a few seconds to wait for everyone to turn their videos on. 3, 2, 1. 3, 2, 1. We still have people turning on their cameras, so we will wait a few seconds. 3, 2, 1. 3, 2, 1. 3, 2, 1. That concludes the photo taking session of today as well. Once again, on behalf of the organizing committee, we would like to extend our warmest round of gratitude and appreciation to all our speakers, moderators, and participants for making the international webinar on health challenges of refugee children a great success. Furthermore, the International Pediatric Association also conducts routine webinars with a wide range of topics concerning child health. To keep yourself up to date, we urge you to follow IPA on our social media platforms as detailed on the slide. We have several opportunities for you to participate in IPA webinar and activities as well. First, IPA will be having the IPA Congress next year in 2023. Register for the early bird prize before the 15th of April. For more details, log on to www.ipa2023congress.org. IPA also provides opportunities for healthcare workers to enroll in the IPA Vaccine Trust course to become a certified vaccine champion. The course is open to all healthcare workers for free. Refer to the post and the IPA website for more information. Once again, warmest round of gratitude to all parties who have made this webinar a great success. Thank you, and we hope to see you at the next webinar.